Hey, Dr. Mark Wilson is with us today from the Jefferson County Health Department, and we are talking about a special survey that's being done, and they're asking for your help, our help, in making Jefferson County healthier, right?
That's correct.
So you've broken it down into 5 priorities already.
That's right. Yeah, we've done a lot of work the last several months getting input from the community and looking at a lot of health data, and now we're looking at strategic priorities and how we're going to do
let's
that.
run down the list. So priority number 1 is reduce health disparities associated with race and economic status, ethnic situations. Talk about that for a moment.
Yeah, so they're just looking at statistics and looking at different groups of people. There are differences in health outcomes between blacks and whites, between people who are rich or poor. Not too surprising in some areas, but infant mortality is the one that really stands out. The infant mortality rate for blacks is almost twice that for whites. Life expectancy is as much as 20 years difference in certain neighborhoods.
So here's what we're doing. We're running down the list of priorities. You've broken it down, but you're asking people, how do we actually implement this? So we'll run through number 2, promote physical well-being through healthy lifestyles.
Yeah, this is things, just simple things like exercise, healthy eating, not smoking.
Some of them are pretty obvious, aren't they?
They are, but how to get people more likely to do those things is the challenge.
The next one, optimize the built environment, transportation system, and safety.
Right.
So is that like where you are, what you already have?
Yeah, so the environment we live in affects whether we have a healthy lifestyle or not. So built environment, a lot of it has to do with things like bike lanes, sidewalks, walking trails, access to parks.
And those are really popular now, becoming more popular and being built into cities, right?
That's part of the plan, yeah, and make it easier for people to get exercise.
Okay, optimize healthcare access.
Still a big issue in Jefferson County. A lot of people don't have health insurance. A lot of people don't have access to health care.
And Dr. Wilson, a lot of us, we're all guilty of this. We don't seek medical care until we're sick, right?
Right, and we want to optimize that, seek medical care more preventively, and also some people see the doctor too much or utilize the healthcare system inappropriately. So we want to make it more appropriate.
And on number 5, something that's been in the news a lot recently, with the death of an entertainer, with mental health, and you're saying look and improve mental health as well.
Yeah, this has been a big problem for a long time and around the country, but in our community there are big gaps in the mental health system.
And when you say the big gaps, what do you mean?
Well, we have a system for severe mental illness like schizophrenia, and if people have money or insurance, they can sometimes get access to mental health services, but it's not always covered. But there are a lot of people in between those that don't have access at all.
A lot of people go undiagnosed.
That's right. There's a lack of awareness. There's a stigma associated with mental health problems, but we know that affects virtually all families. So we have a lot of work to do in that area.
What can be done there? I guess that since that is just something that's happened recently that's been in the news, just looking for the signs and helping someone?
Some of it is education, helping people recognize simple things like depression. Some of it is the workforce. We don't have an adequate mental health workforce. We have to figure out ways to do that. There are not enough mental health workers per population.
All right, you've heard the top 5 priorities. Now, how can folks help?
Right. Yeah, we are asking for everyone's help. You can go to the health department's website, jcdh.org, look for Community Matters 2020. There's a box there you can click on and give us feedback, suggestions on how you think we can accomplish these things.
All right, very good. Dr. Mark Wilson, thanks so much.
Thank you.
All right, now here's Jay.